Namaskar, friends. See, this belly fat, overweight, and then obesity, they are a clear indications for a person is having insulin resistance and fatty liver. See, if these two things will lead to a lot of health problems. Let's look at them. See, anybody's obesity, they have liver disease. Just now I told you it could be fatty liver, hypertension, type 2 diabetes, cancer risk, mood disorders, heart disease, reproductive disorders. All this can happen, but there may not be any symptoms, friend. Look at hypertension, there is no symptom. Type 2 diabetes, don't wait for the symptoms. A lot of people think, okay, general idea is okay, type 2 diabetes means frequent urination, frequent thirst, and then feeling lethargic and loss of energy and all that, because it's not necessary everybody get those symptoms. Few will get, few will not get. So don't wait for the symptoms, friends. And one of my relative who was working in abroad, he's a 49-year-old male, 5 feet 7 inches, he's 84 kg. I was telling him to get the test done. He got it done recently. Look at the parameters. He was not having any symptoms. He was absolutely working a very physical work as an engineer in a factory there. Look at his fasting sugar is 163.5, very, very high. HbA1c is 11%. 11% means very advanced stage of diabetes. And it's the first time he's knowing about this problem. And he has no symptoms. Only because he got this test done, he knew it. If fasting insulin is 6.82, 6.8 is low when there is a sugar of 163 and HbA1c. That means his pancreas have worn out to a large extent, and his D vitamin is also low. No, friends, what are the tests to be done? Many people I've seen, they get the test done based on packages. Sometimes somebody has a thyroid, they only get thyroid. Somebody has a sugar, they only take. I've seen people in front of the parks and all that. There are people now, doing the blood test and BP test. And I've seen many times somebody getting a 120 fasting sugar. The man was telling me no issue, and he's overweight, he has large belly fat, and he's coming there. So he'll be on the wrong, comfort level, which is wrong, friends. How to check what are the parameters? In my last 9 years, I found these 10 parameters. Spending minimal money, we can know 80% of our health issue. What are those things we just studied? Fasting blood glucose should be done in the lab, not on the on the glucometer on the in front of the park. Fasting insulin, HbA1c, lipid profile, D vitamin, B12, thyroid profile, complete blood count, urine analysis, ESR. These are the 10 parameters. 63 blood tests will be happening. The 63 blood test, so I got it done, friends. And on the 22nd of December, I have asked Aarti Labs to give a package, and actually we were getting similar package from Healthians, and we found it is good. But I thought we'll have an alternative. Aarti Scans chairman is one of our group members, so I've requested him. So this actually package is costing is 3,700. So I'm not promoting Aarti Labs or Healthians, friends. I want to tell you all these 10 are important. Wherever you want to do, get it done. Find out the price. Go to a good lab where the test is done in the same lab. Many times what happens, some labs they collect the blood and send it to some other labs. So try and see where the facility is there. Aarti Labs has a robotic facility, so please get it done there. Now, friends, what are the health and immunity parameters? See, one should not be on medication at all. See, when I meet people in the park and the person is overweight, have a large belly, and is not able to walk, when I ask him, he has no health issues. So when I ask him little more elaborately, they say, yeah, he's having a slight BP, light blood pressure. I asked him, what is his blood pressure? He has no idea. What is his sugar level? He says it's control, sir. What is control? So people don't understand what is fasting blood sugar, what is PP sugar. Fasting sugar, PP sugar are not very important criteria. The important criteria is HbA1c. Friends, let me tell you, even HbA1c could be below 5.6% non-diabetic, but the person may be having other problems that only will be known with fasting insulin, as we talked. So anybody taking medication, they must get this 10 test at least 6 months once and review. Weight as per height, and the waist size also half of height in inches. Immunity, you should not fall sick regularly. In case of sickness, minimal suffering and speedy recovery. Even after drenching in rain for about 45 minutes, you are not falling sick by getting cold cough in the same evening, shows a clear immunity. I see people who stay indoors of the house, when there is a rain outside, they become sick. So that means very poor immunity, friends. Appetite should be good. You must feel hungry. And gut health, you must be able to pass twice to stools. Sleep quality, you should be able to fall asleep within 5-10 minutes in the night. And 7 hours sleep is absolutely essential between 10 p.m. to 5 a.m. You comfort levels in the body, no pain, no discomfort, lethargy in the body. And mental peace check, enthusiastic in doing things, a spring in the steps. Like you see the children, the way they run, that should be the approach and attitude of the elders also, if they are having this good immunity. Lung capacity, holding the breath for 90 seconds. And then heart health, climb 60 steps in 1 minute. Flexibility check, you should be able to touch your toes without bending the knees. And then brain health, stand on one leg balancing for 20 seconds. Skin and hair, clear healthy skin, no hair loss while pulling one or two strains. If you have all these 12, consider you are having by and large a good immunity, friends. Yeah, track insulin resistance, like I just, these 10 tests are a must, friends. Okay. Right, these are the few people who have benefited by following Wellness Secrets Life Without Medicine. And my name is Gangeshwar Rao. I'm not a doctor. These are the 10 parameters I said to you, friends. No medication, weight and waist size, blood pressure, insulin resistance, fasting insulin, fasting glucose. All right, at one time, look at, friends, out of these 11, 10 parameters, I was okay on only one parameter. And in 4 months, by following Dr. Manchana's natural lifestyle, my health score has improved from 10% to 80%. What is 10%? Out of 10 parameters, I was complying only one. Though it is a very rough calculation, just to get an idea, semblance. See, I always believe a squint-eyed person is better than a blind man. So let's have some understanding of health, friends. Anybody wants to join this Wellness Secrets free WhatsApp group, where I keep sharing the knowledge and I guide people. I don't suggest any medicines, friends. And my mobile number is 9840852996. If you like this video, please share to your friends. You can watch other videos to enhance your knowledge. You must invest time to improve your knowledge. Thank you very much.